On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham, and we are joined today by one of my favorite doctors here at Covenant Health, Dr. Katie Hendley. She is a neurologist and a movement disorder specialist. Dr. Hendley went to medical school in the muggy town of Houston, Texas. That's right. University of Texas. She stayed in Houston for residency and fellowship training in neurology, specifically movement disorders. And she's been with Covenant since 2011. Today, she's joining us to talk about sleep, something that I close my eyes with every night, praying, making a few sacrifices to the gods to get a couple of hours. And it's such a trending topic right now. So that's what we wanted to bring you in to talk about today.
Perfect. Yep. That's great. Yeah, sleep, obviously, I think is one of the most underrated parts of our health, especially those of us, which is all of us who have really busy lives. A lot of times the parts of our day that we finally get to ourselves are the times that we could be sleeping, but we often find other things to do. And over the long term, that can be detrimental not only to physical, but also to mental health. So happy to talk about it and glad that you guys have picked it.
Yeah. So let's start with the problem.
Okay.
What are the most common sleep disorders that you see in women, and how can they be managed?
So probably if you were to take everybody, one of the most common sleep disorders is sleep apnea. So that's going to be what you think of, someone who snores or stops breathing in sleep. And I would say, first of all, if that's something that you or your bed partner struggles with, that would warrant a appointment with your doctor. And a sleep study. And a sleep study in general, a well-done sleep study will find most major sleep disorders. And so that one, fortunately, has a pretty good treatment for it. It's not that glamorous, but it is helpful in somebody who struggles with that. If they do get the treatment for it, it can be life-changing. And even those, it's not uncommon to have sleep apnea in your 20s. So that is not an old person's disease. It is not necessarily a disease of somebody who's obese or overweight. So don't be in denial if, your bed partner or yourself feels like you're snoring or stopping. That is something that you should get medical attention for. Other sleep disorders, specifically in women, I see restless leg syndrome in women, and that can be really uncomfortable. It's one that can happen in pregnancy, also in anemia. And so these are disorders that women experience more than men. And you don't have to have a sleep study for restless leg. Actually, the definition, and you have to meet criteria for this, is any uncomfortable sensation. And it actually doesn't even have to be in the legs. So it can be in the arms or other parts of the body. Any uncomfortable sensation that creates an urge to move, worse in the evenings or with periods of rest, but movement relieves the sensation. And so if you meet those, you have restless leg. And it warrants a workup for that, and there's also good treatment for that. But you can imagine the time you're trying to rest and lay down, and the only thing you can do is to get up. I've heard stories of people having to get on a recumbent bike or take baths or, get on their treadmill in the middle of the night. So obviously that's disruptive to sleep. And then kind of the general insomnia I hear about a lot, and there's various reasons for insomnia. Mental health, anxiety, hormones, just primary insomnia. Probably a lack of structure and sleep during the day. Medical problems can lead to insomnia if your blood pressure's too high at night, if your thyroid's overactive. I would say probably those are the big sleep disorders. Some early morning awakening, I hear that in my older women population. They tend to fall asleep okay, but it comes 3 or 4 a.m. and all of a sudden they're awake, and that can be disruptive to quality of life and the things that they want to do during the day.
I think I had restless leg syndrome when I was pregnant, and I think just magnesium, which it went away after baby popped out, and then I was waking up in the middle of the night for other reasons.
Right.
Thankfully, he sleeps through the night now, though. But some of them can be simply, I think when you said the treatment for sleep apnea is not glamorous, are you talking about a CPAP machine?
Yes, I am.
Yeah.
Yes, it is a device that's worn. It comes in various different forms, whether you have the full face, the nose, there's even some implantable treatments for sleep apnea now. So it is evolving. But fortunately, there is a treatment for it. And if someone can adjust to that, again, it can really be life-changing in the way that you wake up. And I know people who are on CPAP for sleep apnea, they won't even take a nap without it. It is that crucial to their quality of sleep. Travel with it, all of those things.
Are we supposed to be napping? I would love a good nap right now, but are we supposed to nap during the day?
So, I think that napping, I think, is gaining a lot of, what's the word? Maybe attention or, this younger generation is really putting importance on naps. And I think that a strategic nap, which means probably one that's 20 to 30 minutes, like well positioned in the midday, can definitely be beneficial to productivity, to alertness. Now, if someone is waking up around 9 or 10, they're napping for 2 to 3 hours in the afternoon, not going to bed till 12 or 1. When our sleep structure and our sleep schedule starts getting off, and I think that tends to be both maybe a teenage problem and then an older population problem. When my patients even hit retirement, they lose structure to their day and they have fluidity to these sleep schedules. And that's when over time we kind of have to reset. So, okay, we need a consistent wake time. We need a consistent bedtime. And if you're very active during the day and you're exercising and you need a 20 to 30 minute power nap around 1 or 2 o'clock, that's great. But if, for total, we need 7 to 9 hours in 24. And so if 2 to 3 of those are in the day, guess what you're not going to do? Probably sleep 7 to 9 at night. And so you have to factor in where you're positioning that sleep. But sure, a power nap can be helpful if it's strategic.
I will say I love my naps. I don't get them as much anymore as in college.
Right. Sometimes you have to build that in, or have a weekend day where, yeah, you can nap as much as you want, but that's not the norm.
That's Sunday afternoon after the church football game's on. You may or may not nod off for a second. Hopefully you wake up and your team is winning.
Yeah.
But the Sunday afternoon naps, those are good.
Yes.
You mentioned a second ago going to bed and waking up at the same time, which I think falls under the realm of sleep hygiene. So can you explain to us what sleep hygiene is, and then what are some other tips that go along with those consistent sleep times?
Yeah. So sleep hygiene is kind of best practice for sleep. And it can be both individualized to the person, but it's also, fairly common in the things that will add to good sleep hygiene. So yes, consistent wake time and consistent bedtime would be the first part of that, but then also what you do during the awake day. So, we don't really like to hear this, but regular exercise is so important for so many things. And being active during the day, like a dedicated attention to physical activity. It's more than just, if I walk around the hospital all day, yeah, that's part of it. But I need like 30 to 45 minutes of cardiovascular exercise where, I get my heart rate up, I sweat, I work out my joints. That can be helpful for sleep hygiene. The other thing that can help with sleep hygiene is not having a big meal late in the day. And I think just with our schedules and how we do the day-to-day, that tends to be our biggest meal, kind of that 6 to 7 p.m. It tends to be like our least healthy meal. And so potentially even moving that to the middle of the day and having a lighter meal at the end of the day, because even things like reflux can add to poor sleep hygiene. Things that we know, avoiding caffeine and alcohol late in the day can help with sleep hygiene. And then really avoiding sleep aids, I would say, needing to consume like a medication or alcohol, even over-the-counter sleep aids, probably in the long term aren't beneficial. The PM and Tylenol PM or Advil PM is Benadryl. And that is sedating, and that's what adds to it. But over time, the antihistamine and anticholinergic effects are not great cognitively. It's very drying for the eyes and the bladder and constipating. And so maybe staying away from some of those things to promote better sleep hygiene.
You mentioned it, sleep aids, which is something that we talked before we started recording, but I think we're all big fans of the Sleepy Girl mocktail, which can be used as a sleep aid, even though it's not a medication. And we all agree that we loved them. But let's talk about those for a second.
Sure.
Like, do they actually even help?
So, the Sleepy Girl mocktail, I'll put into what I like to call like alternative treatments, right? And so there's no data behind it. There's no FDA proven benefits. But, it adds to things like self-care and a routine, which can be helpful for sleep hygiene. The Sleepy Girl mocktail that I like has the tart cherry juice, a magnesium powder, and magnesium has had some sleep promotion benefits. There's some additional sleep aids in there. And then I like the lemon lime poppy or the raspberry rose poppy, which can also be, helpful for gut health. And so, if it's a Sleepy Girl mocktail versus a bottle of wine, I think we would all agree that the Sleepy Girl mocktail is going to be the better choice for that. And if that adds to your overall sense of wellness and self-care, as long as you're not spiking your blood sugar and things like that, and why not? If there's no downside to it, I think Sleepy Girl mocktail would be great.
Just a little treat at the end of the day.
Yeah,
So why not?
exactly.
Yeah,
I like
okay.
the raspberry
Other-
rosé too.
I like that. Yes. Other things are like not having bright light exposure late in the day, kind of unwinding, dimming the lights. If you're somebody who likes your bath or shower at night, just getting in that routine so your body knows, oh, she's getting ready to go to bed. And so I also need to be, the mind needs to start winding down. That can all add to, healthy sleep hygiene habits.
For those of you who are listening to this podcast on your phone, don't turn it off. Please continue until the end of the episode. But that's a big problem, is being on our phones, especially like in our bed right before we're trying to go to sleep, right?
Right. You just want to check that Instagram one more time. Did somebody post one more time? Sure. I mean, guilty, right? So, some alternatives would be maybe, some meditation. I like Spotify for, certain music, certain playlists to wind down.
Who wants to fall asleep to this podcast?
I mean, maybe.
Okay. Yeah. Thanks, Dr. Haley.
Sure. Yeah. So, I think that's all training ourselves to. And then if we do wake up, not grabbing the phone, right? I mean, how tempted are we to, well, if I'm awake anyway, I might as well just scroll. It's probably not going to add to better sleep.
I have another question, a toddler mom question.
Ooh.
When you have a baby, like they tell you all these things for sleep, and so they were like, put on a red light, it's less disruptive, you have to get up and change a diaper in the middle of the night, but also like white noise, because apparently your womb is really noisy, so they get used to having all that. So when he was in our room for the first 4 months of his life, we got so used to the red light and the white noise that when we moved him to his room, we were like, nope, that has to stay with us. And now my husband and I cannot sleep without sound. And we can't sleep without the red light on. Are those okay things, though?
Sure. I mean, why not? I don't think that they're detrimental. And if those are things that you've found for your environment to make your sleep more quality, absolutely. Go for it.
I use this podcast as like my personal help save my personal venting session. Yeah. All the questions. So here, I got you. Well, let me just ask.
I want to jump back to magnesium for a second.
Okay.
I've seen that there's a bunch of different types of magnesium, right?
Yes.
What is the best one, I guess, for sleep if you are going to use it for mocktail or whatever?
Yeah. I think the one that's in the mocktail is magnesium glycinate. And to be completely honest, I don't know the different details in terms of like sleep. So I just go with the label on the magnesium supplement. I mean, none of these like nutritional additives are studied. And so it's hard to really, put a lot of like emphasis behind one versus the other. And I think L-theanine maybe is a supplement on some. And then whatever adaptogens are, I'm not sure. But those also add to, I'm just hopeful, like I'm not ingesting like mushrooms. I'm not sure.
Yeah.
But
Just making sure none of them are bad.
yeah.
So I've seen a lot of stuff about circadian rhythms recently. Can you kind of explain what they are and how they affect our sleep patterns?
So, I think we all have our natural circadian rhythms. And, it has to do kind of when the sun set and daylight savings and, our body kind of winding down. We have our own endogenous melatonin that also kicks in there and kind of tells our body it's time to, to go to bed. And I think it fits with, what we think traditionally is a 7 to 9 hour bedtime. Whatever time you have to wake up, I think you can also kind of train your circadian rhythm as well. I think that's why we see disruptive sleep in shift workers, because their circadian rhythms are off and it's hard for them to ever get back on, good sleep patterns. And then I talk to people occasionally who have, quote, never slept well, and they do well on 6 hours a day. And, trying to change whatever your natural sleep pattern has been your whole life. You get, to your second half of life and then you decide you want to change how you've always slept. I think that, part of our circadian rhythm is part of our own makeup and our genetic makeup. And so trying to change some of that may not be possible if that's just kind of how your sleep has always been.
I do well off of 6 hours. My husband is a 9-hour, and of course, we married each other. So I have gotten up on the weekends and lived an entire life before my husband gets out of bed.
Right,
But
right.
it works for us.
It does. Yeah. And I mean, going through medical training and going long periods of time without sleep, I think, that's true for me as well. Whereas other people in my household, if they miss one or two, like we've got 3 to 4 days to catch up on that. And so I think those are just kind of inherent differences that we have. And being in tune with that can be helpful to kind of set your own routines along with your jobs and your family schedule and things like that.
You've got teenagers in your house. I feel like they're probably zombies if they don't get there.
Yeah.
9 hours.
Yes, they are.
So you brought up a good point, though, is like cognitive function when you don't have sleep. I've heard before that like driving while tired can be just as dangerous as like driving while intoxicated because your brain isn't working properly. And you said that at the beginning of the episode that like it is one of the most overlooked but important factors for our health. So why is our brain so impacted by our amount of sleep?
Yeah, so I think not only in the short term sleep deprivation, but chronic and long term sleep deprivation does have consequences. Exactly what you said. Like if you are, sleep impaired, that does affect not only your driving, but your alertness, your ability to respond, with mental sharpness. Your emotionality is different on somebody who's sleep deprived. You just don't handle stressful situations as well as you would. If you are well rested. But then, long term, we do have inherent systems. We're kind of learning more about sleep because, to be honest, we don't really understand sleep in total. Like everybody has sleep architecture and you go through these different stages. And we can tell that it's cyclical. You go through, stage 1, 2, 3, you go through REM sleep in this cyclical form. And that's what sleep studies show beautifully. Somebody cycling through their sleep, but we don't really understand why and what's happening. And so this is even an evolving practice and even an evolving specialty, just sleep. But there are systems in place neurologically that during sleep, not only physical recovery for the muscles and the circulatory system, but also the nervous system. Like that's the time that, for lack of a better word, like toxins are cleaned out. That otherwise can build up over time. And sleep deprivation over time is a risk factor for cognitive impairment later in life. And so for those of us who are in the young and middle stages of our life, you think, oh, I'll worry about sleeping later. Well, probably not a good idea because you're setting yourself up for cognitive dysfunction later in life. And these years and these nights of sleep now really do add up over time. And so if there is a reason, to kind of get your sleep under control and as best as you can, know that you're doing it for your future self, your retirement self, to stay as sharp cognitively. And then you add things like depression, anxiety, none of those are better in a sleep deprived state. Not to mention, your risk of heart attack and stroke and respiratory disease. I tell my patients often, like, I can't help you feel better during the day if you are not well rested at night. So a sleep deprived state is hard to physically work through. So again, back to it being one of the most underestimated aspects of our health. It's definitely an area, if you're generally healthy, except that you don't sleep, it's a great place to start working on, to set yourself up long-term for good health.
To be more proactive rather than reactive.
Absolutely. And again, the idea that, well, I'm too busy now, or I'm too anxious now, I'll worry about that later. Probably not a good idea.
So you and I are both wearing Apple Watches right now.
Yeah.
There are things like Oura rings, all these things that are supposed to help us.
Yeah, my Whoop band.
There you go.
Yeah.
That we're supposed to help track. Are these things actually helpful to give you like a pretty good idea of whether you're actually hitting? Because like if you asked me last night, did you hit your REM cycle? I'll be like, I have no idea. But my watch might be able to tell me if I did. So are these actually beneficial, these devices?
Obviously that's kind of an individual decision. Before I had my device, I thought, well, I don't want to know, right? I felt like I was going to be shamed by my Whoop band. Because things I already knew I was doing poorly. But, it does allow you to track trends. For instance, you fill out questions that you can select, and it will give me feedback on, oh, when you do this, your sleep is better. When you do this, your recovery is worse. So these are the things in general you should consider doing. And so I would say personally for myself, it has helped me maybe make better health decisions. Does that mean long term I'll be healthier, I'm not sure, but at least it's something that I'm actively looking at that I wasn't before. So if you like data, if you like, other devices kind of telling you, what's going on, sure, give it a try.
So, how do hormonal changes during different stages of life, like menstruation, pregnancy, menopause, affect our sleep?
Yeah, I think we can probably all vouch for, cycling through seasons and periods of good sleep versus poor sleep. Definitely the perimenopausal time, sleep starts changing. It's harder to sleep in the second and later half of life due to those hormonal changes, not only just sleep disruption in general, temperature dysregulation, not to mention like newfound joint back pain, things like that. And so, yeah, as we age and move through seasons of life, more attention to sleep, I think it becomes, a bigger impact on our quality of life. When you're a teenager in your 20s, you're going through, usually it's not because you can sleep anytime, anywhere. I think having children definitely changes that. I mean, pregnancy itself, and then small children definitely changes the sleep cycle. So yes, hormones do play a role in making sure that, where you are in your hormonal journey and your cycles and things like that, being as on top of that as you can, will only add to better sleep.
We have another trending topic that has been big. So we've talked about Sleepy Girl mocktails. We've talked about these tracking devices. But another thing that I've seen is called mouth taping, and it's supposed to help change the way you breathe. So you're breathing out of your nose more than your mouth. Is there any science backed by that? Or are some of these things that we're doing more of like the placebo effect, and that's what's actually helping us?
Yeah, I was not familiar with mouth taping until you described it. I wonder if it's similar to like the nasal strips too, kind of changing your anatomy and your natural sleep form. I think some people, though, are just mouth breathers because we know after they have a sleep study and depending on, they would only fit for certain masks. And so if you're a mouth breather, it doesn't matter if you have the nose mask, you need the full face. So does closing your mouth force you to sleep better? Honestly, I don't know. I don't know if that would add to deeper sleep. What I would say is try it because I can't think of any really unsafe or negative side effect, and see if it works for you. And it seems like it would be a relatively inexpensive and maybe easy fix. Kind of a rule of thumb, I think that's just my own rule of thumb. Anytime I talk to a patient and they wanted to try something, and let's say it's an alternative or even prescription, I say 2 weeks. Give it 2 weeks before you make a decision because you're going to have good nights and bad nights, good days and rough days. So if you really want to know, compare 2 weeks on the change or the treatment to the prior 2 weeks and then go from there because one night on, one night off may not be. So I don't know.
Have you given it 2 weeks?
It's been more than 2 weeks, and honestly, I think it has worked a little.
Is it any kind of tape or is it?
I mean, mine are specific. They kind of are shaped like lips. We're not branded or sponsored, so I'm not going to tell you which ones.
Okay, but there are specific mouth tapes.
There are specific
for
mouth
sleep.
tapes. Yes, they do have a little hole in there, so I'm not going to suffocate myself.
Okay.
Which is a positive. So
you're still breathing through your mouth.
You can basically.
Okay.
So it kind of forces you to breathe, but I would say in an emergency situation, the other day we had a dust storm blow through town and found myself, I had pulled the mouth tape open a little bit because I just don't think I could breathe through my nose. So
you'll probably
you're not going to suffocate in the middle of the night is what I'm trying to say. You will survive the mouth tape.
And you would need clear sinuses to do that.
Yes.
So okay.
I got my allergy shot today, so tonight might not be a good night. I can't really breathe through my nose, so maybe tonight's not a good night for my mouth.
Perfect.
But and again, that's what I'm saying. Maybe it is just whatever makes you feel better.
Right.
Is there science behind it? I don't know. My doctor just said no. Does it make me feel better at night? Yeah, sure does.
Are you sleeping better? Okay.
Yeah.
Great. Same as your red light and your white noise.
The red light, my white noise,
perfect
tape. Yeah, my husband. What do they say? The uglier you go to bed, the prettier you wake up in the morning.
High maintenance to be low maintenance.
High maintenance to be low maintenance. I like that. That's a whole nother episode. But we're kind of running out of time. But is there anything else about sleep that we didn't get to that you think is just super important for us to know?
I think I've probably said it several times, but overall for health, those who sleep better have better metabolic states. They are able to keep weight off better, eat less, their energy is higher. And so, I can't stress the importance of, if you currently feel like your sleep is not quality, or you have, a true sleep disorder, that is not a minor thing that you would be wasting your physician's time with. That would be something that I would encourage you to, seek treatment for, seek care for, not only for your young, middle-aged, or older self. Like it does impact quality of life, physical and mental health in a very impactful way.
It is time, our favorite time of the show. We're going to have you pull a trending topic out of our bowl.
Okay.
And we're going to talk about what we see. So
Okay.
read it out loud.
Trending theory. Women need more sleep than men because our brains work harder.
I would like your personal and medical opinion on this one.
There's two questions there. Do they need more sleep or do their brains work harder? Like there are two. I would like to say, of course, women's brains work harder.
Of course, we're going to say that on this podcast.
I don't have any data to say women need more sleep than men. I think in general, it's 7 to 9 hours. With good sleep habit, good sleep structure, sleep hygiene, so we can all work harder.
As a doctor, a working mom, it's funny that that question comes up of like, oh, do we need more sleep? But are we the ones getting more sleep? No.
Probably not. Yeah, the late hours of the evening are when I'm most productive at home, unfortunately. So having to carve out that time to go to bed.
Mine is getting up at 5 a.m. before the rest of the house wakes up because no one's calling me.
Isn't that a great time though?
It's wonderful. I used to never.
So quiet. Never. It's never as quiet as it is at 5 a.m.
Yeah,
I love that.
No one else is awake yet. You and the dog. Get all your things done. Have your cup of coffee.
Yeah.
Eat breakfast before somebody else asks you if they can have some bites. Mommy, bite. So if you want to eat your breakfast in peace, get up at 5 a.m. So, well, Dr. Hendley, thank you so much.
Thanks for having me. Appreciate it.
Great conversation. Join us next time on our next episode where we uncover your topics you want to know. So if you have any ideas, send them to us, Covenant Health on Instagram. We'll see you next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.
Leaking when you laugh, pain during intimacy, it's more common than you think, but it's not normal. Your pelvic floor might be trying to tell you something. Join us to discover why this hidden powerhouse is key to every woman's health.